What are the serious complications of out-of-control diabetes? There are so many hidden dangers associated with diabetes, before the diagnosis and afterward, if the condition is left untreated. It's why diabetes has become known as the silent killer. According to various statistics, there are about 18 million type 1 and type 2 diabetics living in the US. That's not including pregnant women with gestational diabetes or other kinds of diabetes people can suffer from. Most people, diabetics too, have no inkling of how dangerous their disease can be. Would it surprise you to know that diabetics will die, on average, 10 years earlier than people without diabetes? Why the shorter lifespans, though, even if they're taking good care of themselves? This is not so easy to answer, but it all boils down to the complications diabetes patients tend to have. Diabetes complications. What are they, and are they certainty? In short, these are chronic health conditions that affect a diabetic's body. These conditions are the result of a condition doctors have dubbed advanced glycation end products, where an excessive amount of sugar gets into the cells. Age can cause problems such as vascular disease, coronary artery disease, kidney disease, blindness, peripheral neuropathy, loss of feeling in extremities, retinopathy, blindness. Poor oral health. Another not so widely known complication of diabetes is poor oral health. When you have diabetes, you're more susceptible to mouth problems such as cavities and dry mouth. This can cause ulcers to develop too. Gingivitis is another oral health issue, which can be identified by red, swollen, and bleeding gums. It develops because the mouth is unable to get rid of foods and bacteria, dry mouth. Diabetes can also cause mouth infections. While most people view infections as being bacterial, they can also be fungal, such as thrush or a yeast infection. Sugar thrives on people who have uncontrolled or undiagnosed diabetes. Another serious oral problem diabetics have is periodontitis, which is an infection that affects the mouth's supporting structures like bone ligaments. With this gum infection, you could lose your teeth early in life or suffer from gum abscess due to the lack of collagen in the mouth. The real problem about diabetes is that, in most cases, it's not diagnosed until it's too late. That's because there are no noticeable symptoms in the disease's early stages. With untreated, undiagnosed diabetes, these complications can get some traction because of age. And statistics demonstrate that more than 5 million people have diabetes but don't even know it. The general consensus about diabetic complications is given time and uncontrolled diabetes will lead to complications. The longer the diabetic does not know to take care of themselves, the higher the chances for complications to ensue. How well a person controls their sugar levels will dictate their complication risk. When the body is constantly hit by highs and lows of sugar, it puts pressure on the cells, nerves, veins, arteries, and capillaries. This will lead to complications. However, by maintaining constant control over blood sugar levels and staying active physically, you lower the chance of diabetes-related complications. Diabetes risk factors. A person considered to be pre-diabetic can go into full-blown diabetes if they have any of the following factors: overweight/obese, family history of diabetes, lack of exercise, history of gestational diabetes, ethnicity. People 45 and older with any of the above risk factors need to be screened annually, your yearly medical exam. According to statistics, these individuals make up most of the diabetes diagnosed cases every year. Doctors will use two tests to diagnose a person with diabetes: fasting plasma glucose test, oral glucose tolerance test. Both tests will demonstrate the body's glucose intolerance, where the blood sugar is considered higher than what's deemed normal. Of course, this is no real indication of actual diabetes.